Hello everyone. Today we are going to start a new medicine, Nuxomica. So it is a very useful polycrest and an important medicine, but it is a very elaborate. So here I am just giving you a symptom picture or a superficial picture of Nuxomica. Okay, so the common name of Nuxomica is poison nut, as we all know, and the thermal reaction is chilly, and even in cold stage, the even in fever, the cold stage predominates according to Dr. Boerick, and the duration of action is 1 to 7 days, which makes it an acute remedy, but it can also be used in chronic cases and very efficiently. So, starting with the mental generals, the first point we have over here is that the Nuxomica patient is a confident one, so it is important symptom for Nuxomica, and he loves or enjoys power. So these two symptoms combined gives us a good leader, that is a Nux patient. Then he cultivate proteges here, and the patient is fault finding or disposed to quarrel on asking questions. When anybody asks him questions, he just gets mad and starts to quarrel. And then we have hypochondriacs. The patient is over sensitive or over reactive to everything, both mentally and physically, and he relies on drugs and alcohol and stuff. So this is a gist of mental picture of Nux vomica, starting with the physical generals. So basically all the symptoms of Nux vomica just gives us a picture of modern life, the life in which we are today, and especially during the lockdown period, when we were doing like sitting in the couch for a whole day or sitting in your bed for a whole day. Most people were like this, and the literally studious person with a lack of exercise. So when these patients come with gastric troubles to you or a mental trouble, then you have to think about Nuxomica. It could be one of the similar medicine there. So we have bad effects of stimulants here, the stuff I mentioned below. That includes coffee, alcohol, tobacco. Okay, so there is overeating, there is sexual excesses. So it is a predominantly male remedy, so the patient is a womanizer. So Nux vomica symptoms in female are given by gratiola, medicine gratiola. Okay, so we have these kind of patients comes with gastric troubles to you. So there is a desire for stool with pain, desire for stool with pain. After much straining, the stool is passed and the pain is relieved for a while. Now I am going to give you here two points important. So first one is the contraindication for Nux vomica, when you do not have to give Nux vomica, and another picture is a typical Nux condition that you will have to give Nux vomica here. So contraindication for Nux vomica is absence for all desire to stool. When there is no desire for passing a stool, then Nux vomica should not be given. On the other side, sensation of a lump in stomach, acutely seen in bryonia and chronic in sepia. Sensation of lump in stomach along with pressure in vertex. So this is a very good Nux vomica condition when you can prescribe Nux vomica. So these are the two points very important that you have to remember, and they will help you a lot when not to give and when to give Nux vomica. So we also have brain fag here, which is also seen in Zincum metallicum, which is an antidote to Nux vomica. So Zincum shares many symptoms with Nux vomica, but they are antidote to each other. Then we have backache. Backache is very severe along Nux vomica. The patient cannot turn over in bed. So in order to turn over in bed, he has to sit up and then turn over. So this is the severity of backache in Nux vomica. So the last point I'm going to give you is to always prescribe Nux vomica in the evening or before bedtime, that is HS. So this is just a symptom picture of Nux vomica. I hope you enjoy it. Thank you for watching.